TCE, we are helping people by giving them information about HIV and AIDS. We help them to go for VCT, for voluntary testing and counseling. Then we help people who are infected and affected by giving them advice on how to live positively, and we are giving them advice on how to avoid reinfections.
The door-to-door campaign is the core of the TCE program. In each area of 100,000 people, 50 local people are recruited and trained as field officers. Each field officer has a field of 2,000 people, more or less 400 households. During the 3-year lifespan of TCE, the field officers walk through their fields, talking to each and every member of the community, assisting them to understand all aspects of HIV and AIDS, mobilizing them to know their status and to take control of HIV and AIDS, whatever they are infected or not infected. TCE has developed a tool called PES, the Perpendicular Estimate System, which assists the field officers and the members of the community to take control.
PES simply means perpendicular estimate system, where we ask the people some questions. The main aim for PES is to find out whether those people are well informed with this virus or not. TCE is a program which I like very much because I've learned so much in TCE. Long time ago, I was so afraid to go for VCT because I used to believe that there's no such thing as AIDS. I used to believe that AIDS doesn't exist. So joining TCE, it really opened my eyes. Now I know that AIDS, it does exist, and it does infect all of us, and it does affect all of us. So now I can stand up and go for VCT, and now I know my status.
When TCE comes to an area, it aligns itself with the people and institutions already active in the field of HIV and AIDS there. The field officers inform people about existing services and make referrals when needed. Pregnant women are informed about prevention of mother-to-child transmission and are referred to antenatal clinics. People are mobilized to go for testing. People with symptoms of TB are referred to treatment. People who have tested HIV positive are referred to clinics to make a CD4 count, and if needed, to the government's ARV program. Orphans are assisted to be registered and get government support.
TCE, with their field officers, they moved from door to door. They did house-to-house visits, giving information to the people on HIV and AIDS. Then from there, we had villagers coming in voluntarily for testing. And also the field officers used to mobilize the villagers, organize with us so that we go and provide service to these villagers at their community. So the service was user-friendly for them because we could move from the facility to go and provide service to the villagers where they are staying.
Parallel to the door-to-door campaign, TCE carries out a range of other programs. TCE field officers mobilize passionate community volunteers, involve and train them so that they can continue to be active when TCE ends after 3 years. These programs are the workplace program, children and youth clubs, establishment of vegetable garden, feeding schemes for orphans, support groups, income generating activities, the school program.
The communication between the school and the clinic and the TCE group, it was good. And then they inform us in advance when they will be visiting our school. They were involved in the teaching and learning in the classrooms, offering lessons to learners concerning the total control of this epidemic, being the HIV/AIDS, And then we cooperated well. The learners were able to have knowledge about this disease, its impact in their life, and it's very good for them to have this knowledge at an early age, because they will be able to abstain, they will be able to take positive decisions, they will be able to grow without being infected. And then again, they will have confidence to say no, because this program gives them the information, and then it builds their morale also.
Special for the partnership with Johnson & Johnson was the introduction of the TRIO program. The objective of this program was to give support to people who receive ARV treatment. It starts by the field officers identifying people in need of ARV. When identified, the people are referred to the government's ARV site. But TCE goes a step further. It mobilizes the individual on treatment to disclose to family or friends and assist them to form a trio consisting of 3 members, the client and 2 supporters. TCE offers training to the members of the trio and continues to monitor them. During the 3-year program, 3,000 trios have been formed and many lessons have been learned. TRIO now forms part of all TCE areas in South Africa.
Now, I think amongst other things, the program of the TRIO, when we talk about adherence of treatment, we should not leave the TRIO behind, because I think that's the only way of encouraging adherence to treatment by the patients who are taking the ARVs.
In April 2009, the TCE TRIO program in Western and Sekhukhune is phasing out, and the continued fight will be handed over to the communities. The communities have been open to the field officers campaign and have taken huge steps in understanding HIV and AIDS, and not at least to use this understanding to take action in their lives, change risky behavior, break the silence, fight the stigma, and offer support to those who live with the virus so that they can be accepted and live long, healthy lives.
As TCE, we have managed to talk to more than 200,000 people, since our goal was 200, but us, we managed to talk with 204,000. And we managed to test 25,000 people who received voluntary counseling and testing. And we managed to distribute a lot of condoms, which is a clear indication that the community now understand how to prevent themselves.
We will recommend that TCE be funded by the district and even the local government. What we'll do as the municipalities to write a memorandum, take it to the local government, and also take it to other government sectors, which we know that they can be able to assist in terms of implementing.
The partnership between Humana People to People in South Africa and Johnson & Johnson dates back to 2002, with the first TCE area in Bramfisheville, Soweto. Today, TCE is funded by the USAID, the Global Fund to fight AIDS, TB and malaria, and a number of district municipalities. And it has grown up to 21 TCE areas, reaching out to 2.1 million South Africans in 5 provinces.